Effect of usual medical care plus chiropractic care versus usual medical care alone on pain and disability among U.S. service members with low back pain. A long title, but a very important study in the world of chiropractic. It is in JAMA Network Open, so it's the new Journal of the American Medical Association, open meaning it's available to anybody who wants to go on the site and read the article. Most articles are not fully available. This article is extremely important for medical providers in that it explains the benefits of chiropractic care as well as the safety of chiropractic care. It's important for chiropractors because it shows the effectiveness of chiropractic care in a large number of patients in the military. And it's important for patients, especially those who may have been skeptical or hesitant of chiropractic care. Let's take a brief look at the study. This paper is excellent in that it reviews the key points. What's the question that they asked? What is the effect of adding chiropractic care to usual medical care for patients with lower back pain? What are the findings in this study? It shows that patients who received usual medical care, anti-inflammatories, and rest, plus chiropractic care reported a statistically significant moderate improvement in low back pain intensity and disability at the 6-week point compared to those who received just the usual medical care alone. What's the meaning of this? The trial supports the inclusion of chiropractic care as a component of multidisciplinary health care for low back pain as currently recommended in existing guidelines. So if you're a patient, see your general care provider, see your medical provider, show them this study, and show them the possibility of seeing a chiropractor is a safe one. The common medical therapies for low back pain include the nonsteroidal anti-inflammatory drugs, opioids, which is a huge problem, spinal fusions, many of which do not work or improperly done, epidural steroid injections, the same. All of these demonstrate limited effectiveness. This research is very important because the trial included a more diverse sample in terms of race, ethnicity, and age than found in prior studies of either chiropractic or spinal manipulation. And it's a very large trial in the military, so it's very controlled. Lastly, this part of the paper is very important because it discusses adverse events. And here it says of the 43 adverse effects reported by participants receiving medical care and chiropractic care, 38 of those were described as simply muscle or joint stiffness, and others had to do with epidural injections as well. 3 were described as pain, tingling, or sensitivity in an extremity, and 1 was described as a lower extremity, meaning the legs, a burning sensation for 20 minutes following spinal manipulative therapy. So this shows that the adverse effects were relatively minor and short-lived. As this says in primary outcomes, the groups overall were consistently in favor of medical care with chiropractic care as compared to medical care alone. So it's not one versus the other. It's a combination of proper diagnosis and a coordination of care between multiple providers that can provide you as a patient with the best results.